Good afternoon, everyone. Thank you for joining our webinar, Learn How Technology Enables the Next Generation of Planning and Budgeting in Healthcare. We're going to be highlighting the Workday Adaptive Planning technology and really looking forward to talking with you all. A couple of housekeeping items for today. We are going to be using the Q&A, so if you have questions, just go to the bottom of your screen. You should see a Q&A button there. We're going to try and answer those questions throughout the webinar. If there's anything that we are unable to answer during the webinar, we will definitely reach out and provide those answers going forward. You can ask a question using your name, or you can be anonymous, so definitely there. If you have any audio issues where you're not able to hear us, sometimes that happens in a Zoom meeting. Just go ahead and click the audio settings at the bottom and you can switch over to the phone mode instead of using your computer. So with that, I'd like to start by introducing myself. I'm Ida Cormina. I'm a managing director with Huron. I'm responsible for our planning, technology, and business process solutions in higher education and healthcare. I've been with Huron a little over 6 years now, came in from both the technology and the industry side, spent a number of years working with institutions to get them to use technology to better enable their business processes, and have done that both in the higher education and healthcare space, both working with academic medical centers and healthcare providers. I also have with me my colleague, Charmaine Mascarenas. And Charmaine, you want to introduce yourself?
Thanks, Ida. Hi, everybody. I'm Charmaine Mascarenas. I'm a director at Huron, and I work on our adaptive planning team with a focus on working with our higher education and healthcare clients. I've been in the planning space for about 10 years now, working with clients to develop models across various planning functions, so annual budgeting, as well as going beyond the sort of single year income statement view into balance sheet and cash flow forecasting, more of the rolling forecast views. And yeah, I'm excited to share the demo with you all in the second half of the presentation and answer any questions you might have.
Yeah. And Charmaine actually also leads right now one of our largest implementations of Workday Adaptive Planning in healthcare at a very, very large healthcare system. So, she's going to share some of her real life experiences because that institution is actually implementing pretty much about 90% about what we're going to talk about today. So for those of you who are not familiar with Huron, we have expertise in healthcare across the entire spectrum of our healthcare clients and what our healthcare clients need. So we've served over 450 health systems, and we do that from multiple facets, right? So thinking about strategy and innovation and really helping organizations put together a clear plan for the future on how to position, your organization. Care transformation, really trying to work with hospitals and systems to really provide quality care and increase patient satisfaction and increase clinical efficiency. You go to the back end operations part of that, which is financial operations and excellence. So working with our organizations to really figure out how they can leverage resources, increase cash flow, and be more efficient. And then really helping organizations to implement, which is kind of what we're going to focus a little bit today on, is implementing technology and analytics to really help support, the goals coming out of strategy and innovation, care transformation, and financial and operational excellence. And then working with our leaders and your leaders to really hold them accountable and help them work through driving, some of these strategies and really making organizations that improve employee satisfaction and engagement. All right. So Impact and Beyond, we sent you guys a link to this when you registered. Huron conducted a survey in June of healthcare executives to really understand kind of in the midst of the pandemic, what was their thoughts around accelerating stability and growth post-pandemic? And one of the things that came out of that was that healthcare organizations were already feeling the pressure of not being able to keep up with the data revolution. COVID really highlighted that even more for organizations and showed and demonstrated the need for organizations really to develop their digital capabilities, to keep up with everything that was happening, right? You think about, your organizations having to transition to telehealth, really having to, predict what was going to happen and the impacts of how COVID, was going to impact, your inpatient volumes. How are you going to respond to, the need for additional supplies, right? We could not get enough out of the news talking about hospitals not having ventilators and PPE. So really being agile to be able to move, things forward and to be able to act quickly and act with real-time information and data. The good news is that what we saw, coming out of that survey was that a lot of the leadership in healthcare was also saying that even coming out of this pandemic, they were going to continue to revamp their efforts to move forward with accelerating investments in data infrastructures, advanced analytic capabilities, into enterprise resource planning systems, and enterprise performance management systems. So speaking about planning and budgeting specifically, the things that, as we were talking to a lot of our clients that came out of this, was that most of our clients, and you guys were probably in this situation, is that you put together your annual budget, before the pandemic hit, and then day one of the pandemic, that annual budget was basically obsolete, right? And what that meant was that you had to quickly, move to forecasting on a real-time basis based on the latest and greatest data that was coming in. So as you were trying to, figure out what was happening, with shifts in your volumes, trying to figure out what your variable expenses were going to be about that, trying to figure out how you were going to staff, did you have enough supplies, where were costs going to come from, so really having to have agile data so that you could really make, mission critical decisions real time. Also, what we heard was organizations that weren't on a technology platform, but were on a non-integrated, technology platform for planning, really struggled to keep up with pace, right? Is trying to do all of this in spreadsheets, as every day leadership is asking you about, where we impacted, how is this going to change? What does this mean for us going forward, right? What does this mean also, when we finally get out of the pandemic, and when will that be, and how does that impact us? So organizations really had to think differently. And we really believe that everything coming out of the learnings of COVID really will translate into going forward. And how does your organization enable planning technology to facilitate post-pandemic recovery and reposition for future growth, right? Because, one day we are going to come out of this pandemic, right? And I think all that we learned in reference to having the ability to be agile and, really, really react real time based on information, is not going to leave us. And we're really going to still need to have that, in order to be successful. So what does a planning platform really look like for the next generation of planning in healthcare? And this is what we've illustrated, is that planning platform really needs to be integrated and it needs to be holistic. We used to think about planning as just an FP&A process, and it just involved the financial pieces of the house. But what we really learned is that it really is combining both the financial and the operation, really to make this a real-time, management tool to really understand what is happening, with your organization. So we start with kind of the core things that we call standardizing, right? And those are all of the things that, you normally do today in the gold boxes. So, creating your operating plan, that's variable and fixed, right? Using statistics around that. Your detailed compensation plans, really how deep do you go in those, really to understand, net cost of providers, how do you look at your nursing plans and the cost for those, and how do you flex those based on the information that's coming in. Multi-year forecasting, where you are really looking at multiple years out and just not the fiscal year you're in. And I think even more importantly, and some of you may have already started this or realize even more of the need to be able to do this, is forecasting, which is also known in the healthcare industry as dynamic budgeting and flex budgeting. And when you really look at that, what you're doing is the notion of an annual plan really kind of goes out the door. It's just a snapshot in time. So really what you're doing is continuously updating your information. So you're almost in a continuous budget cycle, in reference to using real-time information to really plan out what's happening. So at the point in time you need to create your annual budget, it really is just a snapshot of your forecast. When we get into the next level, it's what we call plan and prioritize. And this is using a lot more of the operational information. So creating strategic financial plans. So those are your 5-10-year plans out, where you're really looking at, how do things impact, your balance sheet, your cash flow, helping you understand, should you make decisions around, certain initiatives, or capital projects? How does that impact, should you do those now, right? And what does that look like? If you were thinking about bringing a new ER online right now, does that make sense given everything that's going on? And can you really look at the financial impact for that, both from a revenue perspective and an expense perspective? Being able to do net patient revenue at a very, very detailed level to really understand the impacts based on volumes. Looking at clinical research trials and really, determining what the cost of that is and being able to do very detailed budgeting around that. So that really moves you into the plan and prioritize. So you're looking beyond just the financial pictures of that, and you're moving more into the strategic pieces, and the long range planning around that. And then the last piece of this is moving into more of a predictive model. And I think this is really where we've seen the need around this is demand and supply planning. If you look at everything that happened, right, really being able to understand, okay, as we start to possibly bring things back to the new normal, right, what are the appointments that we should bring in first, right? Do we have the staff and supplies to, be able to move forward with those appointments? What are the ones that will impact our revenue the greatest? So really being able to use a lot of that operational information in reference to, what's appointments are being booked, can we move things up early, what's the capacity that we have, to be able to move forward with these appointments. Do we have the supplies? Do we have the resources, providers, nurses? So really doing some really demand planning around that. And we're going to be doing some really, and in the midst of doing some exciting things with Workday Planning in reference to supply and demand planning, that we're going to be focusing on a webinar probably in late this year, beginning of next year, showcasing a solution where we're really using some unique things to really work with healthcare institutions to plan out those things. So in order to do all of this, you really need a technology that's going to be able to support that holistic and integrated viewpoint. So today we are focusing on, our work that we've done with the Workday Adaptive Planning integration platform. And Charmaine will, tell you a little bit about what we've done in healthcare and take you through a demo of how we actually support the ability to have an integrated, holistic planning platform for healthcare. Charmaine?
Great. Thank you, Ida. So to start off with, I wanted to share a bit about the adaptive planning platform that we'll be demoing today shortly. So really what it is it's a tool that allows you to complete different types of planning processes like Ida laid out on the previous screen, along with the reporting and analytics that you need to do to get to a point where you're able to use your data to make decisions, informed decisions off of. So some of the key benefits that I want to highlight and that you'll see as we go through the model is it really is a flexible modeling platform. So what that means is it's going to allow you to evolve your dimensions, or really the elements that you're planning by, over time. And as your organization changes, as different things in the economy change around you and your business processes evolve as well. It also gives you planning capabilities that span across your organization. So you can look at and measure against performance at different levels. So, all the way down to an individual department level, as well as looking more strategically at your total organization. It gives you a single source of truth, so you can make sure that everyone's looking at the same definition. So when you're having those discussions about using the example of thinking about your dynamic or flex budgeting process, as you go into you get actuals for a month and you start to analyze, how did we compare, how do we do against what we had budgeted or planned for, and you're seeing that maybe your volumes are driving most of that change, and you're trying to isolate that. Having it all centralized really allows you to make sure that everyone involved in that conversation is looking at the same definition for a statistic or an FDE value or whatever some of those drivers might be of your plan. And finally, as you'll see, it's got a very interactive user interface for self-service reporting and allowing you to see data visually through dashboards, as well as looking at the typical deep dives into data that you'd want to do, where you can see detail across various time periods and going across diving into the details of your revenues and expenses. So we're almost at the demo, but I wanted to take a minute or so here just to set the stage for what we'll be showing you today. So this slide should look familiar. It's the one that Ida was just covering. What we're really going to do is take a look at a model that has a variable and fixed budget developed. And that incorporates your revenue planning, your compensation planning, and we'll go through the steps of looking at a model where you've got actuals up to date. So you've got actuals through, in the case of this model, through September of 2020. How do you then work on developing a rolling forecast for the next 15 months in this example? And really thinking about how can you use actual performance and bring that data into your model to project those future periods and really get into that continuous planning mode. Ida was mentioning earlier that I'm working with a client that's a big health system, and one of the things they instituted in their planning process this year, really when the pandemic hit, was this concept of a rolling forecast, and really refreshing it every month as they get actuals data or new information to look out not just for the rest of the current year, but looking out at any given point 5 quarters into the future, so that they can use that current information to start planning out what those future years might start looking like as well. And then finally here, we'll switch towards the end to looking at a more long-range planning view. So like I said, looking beyond the income statement, thinking about how does that forecast that you're developing for your revenues and expenses impact your balance sheet, your cash flow, incorporating other items that you might have from a treasury standpoint, and your below the line items around interest and depreciation and things like that. And also understanding how can you use the tool to understand the impact of significant capital projects that you might have, or big initiatives that you're looking at, and do some scenario planning around what does it look like if we included this or excluded it from our plan. Okay, so with that, I'm gonna end this slide here, and we're gonna jump into adaptive and start going through the demo. So right here, I'm on my login page. So I'm gonna go ahead, log into my model. And the first thing we'll see here when we get in is that we get onto an announcements page. This is something that you can customize for your organization to include things like due dates, any guidelines if you wanted to include links to any documentation around policies and procedures or documentation on the system. You can link all of that in here. I've had a lot of clients who found this very helpful to just give a central view for a user when they log in, of quickly giving them links to go look for information that might be helpful. A couple of other things that I can see on my screen here, and you'll see this drop down as we go throughout the model as well is it's telling me what version I'm in right now. So I've got a version that has my October 2020 forecast. You can see the model has actuals, it's got my budget and some other scenarios that we had run as well. But this is a quick indicator to always tell you what version you're planning in and seeing data for. Um, if I click on my profile here, I can get to my profile as well as some product documentation. This help button also takes you to product documentation, and it's really helpful to have it available here, and it's contextual, so it'll take you to the page that you're on right now and looking for guidance on. And then finally, on the left here, if I click on the Workday icon, I come up with what's called the navigation pane. So this is really where most users are going to spend time working through accessing their different planning sheets to, make their updates for their assumptions and review their data. They'll be looking at reports and looking at dashboards as well. You can also see at the bottom here, we've got some more administrative type of tasks and sections of the model, and really depending on your user, your access to the model, you may see more or less of the things that are available here. So what I'm going to do, we've got a ton of options. One of the nice things about Adaptive here is you have this concept of process guides, and I'm going to open up my one of my process trackers here. And what you can see going down the left is a series of tasks that I need to complete as part of this process to update my plan. This is something that you can customize by different types of user groups. So if you've only got, you could have a process guide just for your executives where they're coming in, they're just looking maybe at some high-level dashboards to see where they're at, to get some key information to make decisions, versus having a more detailed list like this, where maybe one of your budget managers needs this to actually go through the different steps to make their updates. All right, so what we're looking at here right now, so we'll first start off with, we're looking at our hospital revenue summary. I'm gonna collapse this so we can look at a full view here. And you can see on this tab that I've got some information about my inpatient and my outpatient revenue and some drivers that impact that. So at the very top, I can see my payer mix for both my inpatient and outpatient. And then scrolling down, I can see my revenue that's being calculated based on some of that information as well. One thing you'll notice here is you see this light green highlighted background on both of them. And what that tells me is it's a quick indicator to say those are months that actually, they have actuals data coming through. And then anything that doesn't have that background is a plan period. So I'm gonna go ahead and go down to a different department in my organization structure here so we can look at what some of the data updates might look like as well. And right here, you can see that my graphs right now are only showing me the current year that I'm in. This model in here is set up with a January through December fiscal year. You can configure that to be, if you're on a July through June year, you can set that up as well. But right here in this drop down, we talked about this concept of rolling forecasts. And in the model right now, at the bottom, you can see that I actually have all those periods available for data entry. So I'm going to go ahead and update my graph real quick so I can see what that's going to look like if I look at my future periods as well. So you can make this very dynamic so that users don't have to go to admins to request building another graph for them, or set something, take data and do this offline. You really can give them that self-service capability right here. So looking at our inpatient revenue, I can see that, based on actuals, they've trended a lot lower than maybe what I'd initially put in an older forecast for the next year and what we would have expected sort of operations as usual to have been. And we've gone in and actually updated our current year forecast to be a bit more in line. As I see that data coming in here, now that I can see actuals coming through, which are indicated in this green font for my for January through September. I have the rest of the year available for inputs, and I also have the next year available here. So maybe looking at this and saying that, you know, we're coming in this year at these numbers in total, and understanding, you know, if you, based on information you might have about the demographics of the region you're in, or just additional information about different rules and regulations, you might think that maybe, you know, next year is going to look fairly similar as well. So I'm going to go ahead and just quickly update my data here. And I'm going to say maybe, you know, we're just going to round that out to being 5,000 admissions for that service. And you can see it prompted me to ask me, how am I going to split that across by my months? So what I'm going to do is just say, use the trend that you see from the prior year. So we go ahead and update that. Let's do that real quick for some of our other accounts here as well, for some of our other services. And once I have updated all of that data, you can see that this is all still in this blue font. So it tells me that I've made a change, but I haven't saved it into the database yet. So just keeping an eye on, you know, the revenue numbers that we're seeing here. We're at about 10 million there for Jan of 2021, going up to about 12 million by the end of the year on a monthly basis. And once I save this data, because this is all real time and available for you for analysis, not only does it take in the data, it goes in and updates some of my graphs in my model that are available as well. So now I can see that change that has flown through across the model, and go and review any other reports or graphs that I might have there. So we didn't, you know, look too much, but at the outpatient section, but it's really essentially following that same approach. You could make the same changes out here. And if I scroll all the way at the bottom, you can see that I've got changes that I can make to visits as well to impact that outpatient revenue forecast. So in addition to this here, I want to show another dashboard that can give you a view of, you know, let's say I wanted to dive in further into my inpatient revenue model and create some additional graphs to show me different drivers that might be impacting that number, look at different trend analysis. The dashboards here are really flexible in terms of the different types of charts that are available, and any information that you have in the model, you can bring into these charts and group it in different ways. So here you can see that I can look at my assumptions around my length of stay by different services. I can see my payer mix by my different payers, and I can look at some quick visuals to see what is my forecast for the month of October look again compared to the prior month at a quick glance. And I can see that there was a reduction there compared to what my prior month looked like. And again, you know, just really thinking about the different visuals that you can bring in. You can see there's a trend here of what my admissions versus my visits look like, to give you those quick visual cues of something you might want to have a follow-up discussion about, or if you see something that's concerning, to make decisions that need to happen accordingly. So let's dive a little bit more into what that revenue model actually looks like. So I'm going to open up my sheet here, which has, and I'm going to go ahead and select my same department that we were looking at. And once this renders, what you can see here is I can dive further into, for my inpatient and outpatient, what are those drivers and assumptions that are allowing me to come up with those updated values for my revenue plan. So we entered in at a total level on the previous dashboard what our assumptions were around admissions and visits. And here you can see that's now getting split across different payers based on some inputs that I've made for what my payer mix is. So I can start looking at what my revenue might look like based on those rates there. I have some additional information here around patient days, around inpatient average revenue per day. And then finally, I can see what my value is for the revenue amounts that it's actually calculating. Another quick note that I wanted to point out here, you can see at the very top here that you can actually see the formula that's driving this logic. If I go and right click here and do an explore cell, it's going to pull up a window for me that actually shows me not just the formula, but the resulting numbers that it picked up as well. So that's another quick view that you can, drill down into the detail to understand what assumptions are being used, exactly what numbers are being used to come up with the results that you're seeing. Another quick view here on the assumptions. I want to show you if you had to go in and change values, you can obviously just go and input that in here. So if I, move this down to a 12, bump that up, I can make those edits and then just carry those forward to the end of my model. If I choose to do so, I can again explore cell here and even look at this concept of a audit trail. So once I click on that, you'll see that I can actually see a history trail of all the changes that were made to that cell. So if you see that, the number changed from what you may have updated it the last time around, you can actually see when that change happened, who the user was that made that change, and what the previous and the new values were. So this is helpful. It can be helpful to, really make this collaborative. And when you have multiple, maybe budget managers that are responsible for the same model, understanding where those changes came from. Okay. So from here, flipping from our revenue, we're going to take a look at, I'm going to discard those changes I just made. And let's take a look at, now that we've made our assumptions around some of our volumes there, looked at our revenue, how is that impacting some of our assumptions and logic around the FTE that we need to support some of these services, right? So I'm going to go down to looking at my department again. And you can see that as I'm selecting different levels of my organization, my charts and graphs and everything on my dashboard is updating in real time. So I can see here that by different job codes that I've got, so I'm looking here as an example at my RNs, my LPNs, and some aides, and I can see what the difference is when I look at the required hours for a specific job code versus how much we budgeted for. And so right here gives you a quick view into, do we need to start having discussions about how we can scale up our resources to meet the need? Or in some cases, if we're seeing we have more capacity than the required hours that we need, how can we, what decisions need to be made there in terms of, regrouping resources or any changes in our staff mix? And just to show you in terms of the logic, what's happening here, down here, I can see a grid again by those job classes. So I can see my LPNs, my RNs across the different periods. And based on the assumptions that I enter here of what the standard of care is, it's calculating a required hours value for me. So if I explore cells, so drill down into that again, I can actually see here that it's looking at that assumptions information that we had previously entered and looking at the assumptions that I put in around the standards of care to calculate for me what that required hours is going to look like. And, this is where really the power of having a driver-based model that's dynamic, where making changes in assumptions that impact not only your revenues, but your expenses as well, can give you that holistic view and make sure you're keeping, seeing the full impact, not just the financial impact from a revenue standpoint, but from any costs that might end up being variable as well. So once we understand the FTEs that are required here compared to our budget, we can then, by looking at information on what their average pay is, understand the financial impact on our compensation as well. So looking at the budgeted hours here, if I do the same drill down into that cell, you can see that I'm getting data from my, if I keep drilling down, from my personnel sheet, and it's looking at headcount. And if I expand that out, right from that drill down, I can get to a lowest level to see who are those employees that are showing up as part of being budgeted for in that specific job code for this specific department. So from here, let's dive into actually looking at what does that compensation planning model to understand the financial impact and the budgeted dollars look like on the compensation. So the first sheet that I'm going to pull up here is you can see in summary that for each job code, I can see different values. So different, my FTE, I can see what my hours are, as well as some of the cost components like salary, shift diff. If you break out your components into more detail, so the client that I'm working on right now, they look at it by, different rates by having overtime for shift diff. If you've got different types of additional pay, you really could break out all that additional detail here as well. And the same thing goes for the benefits, putting in your assumptions around FICA and other taxes, or holistic benefits assumptions, so you can get that breakdown by different job codes as well. So I want to call your attention here real quick to looking at our registered nurses. We can see that there's a difference taking place, or an increase in November. So right here again, if I drill down, I will be able to see what changed in that period, right? So right there at the very top, I can see that I've actually got a new hire that looks like it's starting in that month of November. So if we go into the detail behind this, where we can see all of our employee information, that's where I can actually make changes to say, if I know that maybe there's an employee who's going to be resigning soon, or we're going to be, someone's hire date needs to get pushed out because maybe we don't have we don't have the need in that area. You can come in here and make all of those changes and dynamically update the graphs and that summary that we were looking at. So I've for now just filtered my view here on my RNs, and I can see right here, here's that new hire, which is why we were seeing an increase in the month of November. But if I wanted to make changes to, let's say, maybe we are actually going to think about pushing out this hire until January, I can make that change. You can see again that blue font that indicates I've made a change. And let's say maybe we know that Emily Jones is actually going to be retiring soon. So maybe at the end of October here, we're gonna see this position go away. So once I save that data, we'll go back and take a look at what our summary ends up looking like. And again, this is, really that power of having the driver-based dynamic modeling for the range of time that you're looking at in your rolling forecast, right? Not just for your current year. So I did put in that change where we moved the hire into January, and I can see right here how that change has trickled through. So if, we had Emily there leaving at the end of October, our FTE count goes down and picks back up in January with the new hire. And accordingly, you can see that my cost is getting impacted as well. So I can see the financial impact of the rest of my model. So going from there to look at, we've looked at our revenue, we've looked at our FTE needs and our compensation. Let's take a look at some of our driver-based expenses and our direct expenses as well. So this is a quick report that you can run here. I've run it for a certain department for the month of October to see how is that month, the current forecast, looking against my budget, as well as year to date to do that same comparison of year to date, what does my forecast look like against my budget. And I can see that my patient volumes have gone down, and because of that, I'm seeing an impact on a decrease in some of my volume-based expenses as well. So again, because we've got a driver-based model, so when I drill down into this number, and if you've noticed here, everything that whether you're on a sheet, whether you're on a report, you're on a chart, on a dashboard, you can drill down from any of those places to get down to look at the detail of what's driving that a particular number. So again, I can see going back to the beginning, we'd made some changes around volumes. I can see that impact coming in and updating this account and what the driver is here, using an average cost per patient for this specific line here. If I scroll down, you can see that some of my other non-patient care, some of my direct expenses have stayed the same. So we haven't gone in and revised our forecast there. If we had made a change, we would see the variance coming through. And then you can see, you can do some quick stop lighting on a report as well to give you quick indicators of what should I start focusing on first. And in this model right now, it's really just giving us the indicators based on the range of the change. So the changes that fall into a higher range are getting highlighted in red. In a smaller range, I think it was under 15% in this one, is highlighted in a yellow. So you can start really thinking about areas that you want to focus on and dive deeper into to understand what is impacting that based on actuals and what the forecast might be based on that as well. To quickly show you another view here, going back to a sheet, we've talked about different types of driver-based revenues and expenses. We can also look at, in this model, I'm going to switch to a different department, on how do you just go in and update your direct expenses, right? So we saw some of that breakback functionality on our, when we were updating our assumptions for admissions. And you can use that same concept here where you can see, you know, your actuals coming through, your remainder of the year forecast, and then the forecast into the rest of the year as well. And using either breakback functionality where I can just update and say, actually, we think, you know, our professional fees, maybe we signed a new contract to do some sort of transformation project. We're going to expect that to bump up into next year, and we're going to split that up across the board. I can see that direct impact. And right here, another neat feature on the sheets that you're on is to be able to see a quick chart of what is that view, that trend line look like going across my period here without having to create a new chart for my model. If I wanted to change it, you have a couple of options to, you know, if you wanted to look at a bar chart instead, you're really not going in and having to create a specific model. You're just making the selections from some delivered functionality there to give you a quick view of some of those visual analytics here. All right, and then finally, to wrap this piece up, I wanted to show what that full P&L can look like in the model. So this is a very, you know, simple report that I've got here where I can see my fiscal 20 values. I've broken out my fiscal 21 to be able to see the months rolling up into the quarters, and then included a year-over-year change number as well. And, you know, putting in some of these quick variance analysis columns in here can really give you a quick view into saying, well, something looks off in my outpatient revenue in there. Maybe we just haven't updated our assumptions or our data for fiscal 21. So right here, what I can do is add a note to say that, you know, outpatient revenues need to be reviewed. So whether it's me going back in, analyzing it, or someone else on my team that's looking at it, I can make it collaborative where they can see the notes that were left, when that was left, and directly see it in here on your report instead of having to go back and, you know, send a notes and email. You can collect and make the tool really collaborative by collecting notes and feedback directly in the model. All right, so the next thing I'm going to do, I'm actually going to step out of this model and log into a different one. Like I said at the beginning, I wanted to show what this looks like if you were going beyond the current year. And for some reason, I'm going to just reload that real quick, but going beyond the current year to look at your a balance sheet and cash flow forecast in addition to your revenues and expenses, looking at multiple years and really thinking about how that rolling forecast can feed into some of your broader strategic analysis you're doing. So I'm going to go ahead and open a similar process guide in this model. And to start off here, you can see my first step. I've got a scenario comparison report that looks at two different scenarios. It's got some actuals data, but really what I want to point out here, you can see I've got my income statement lines, but if I scroll down, I've also got my balance sheet data, and I've also got some key metrics. So if you've got any covenants that you need to track to make sure that you need to stay within a certain range, it's really helpful to build those into your model and get them all into a single report. So as soon as you make a change in the model and you come back and look at this comparison, you can see between these two scenarios the impact it's going to have across your financial statements and any key metrics that you're tracking as well. So I want to point out a quick example here where we're looking at a strategic initiative. And you can see on the top right that I'm in a scenario called my new acquisition scenario. And I'm going to go into my organization structure and show you where I've added a new level that says, here's my new acquisition. So maybe this is an acquisition, maybe this is, like Ida was mentioning earlier, a new emergency room that you're bringing online, allowing you to create a target department for it, so you can hold a forecast to say, if we had to bring this online in 22, what is the forecast from a revenue and an expense standpoint to my model? So you can see here I've got some quick lines entered for revenues and expenses. And if I go back to my scenario comparison report, I can actually use this same report to analyze, well, what does my base actually look like against that acquisition scenario? So the only change that's in this model is starting in 22, I have that new that new initiative coming online. So I can see that there's no impact in the first 2 years, but then starting in 22, I have an impact to my revenue, and scrolling all the way down, understanding how that flows into my balance sheet impacts. If you've got any assumptions around, your AR, AP, just your working capital, and if you were maybe had to raise any debt, issue any debt to accompany that initiative, you could really track all of that right here and see what that impact is on your ratios as well. And the last piece I want to point out on that that specific strategic analysis is actually take you behind the scenes a bit and look at how can I isolate that data so only certain people can see it, right? If you've got sensitive information in there about a target acquisition or something that hasn't been shared publicly yet, you can see here in my organization structure that I have a version selector on the right here. And if I look at my new acquisition scenario, this level is available there. If I look at a different version, it is not. And so what this lets you do is, using the same tool, using the same technology, add in some of these target cases and scenario analysis, and lock it down from a security standpoint as well. And what you can do in addition to this is, only people who have access to that specific scenario. So you can isolate it to maybe it's just the CFO and your VP of finance there that can see it, and let everyone else continue planning for their forecasts as usual in the model. Okay, so with that really wraps up the demo portion. I will bring our slides back up here, and definitely feel free to add any questions in the Q&A that we can take on. But Ida, I will hand it over to you.
Yeah, great. So thanks for all the great questions. And so there's a lot of ones that came through. If you have any other additional questions, please feel free to ask them at this moment. Just wanted to share a little with you about, our experience using this tool. We've actually implemented over 20 adaptive planning engagements across, some large research institutions, academic medical centers, healthcare providers. We got the breadth and depth in reference to understanding. I know there's a lot of AMCs on the webinar today. So, we understand, not just the technology, but the business processes that go along with being, a full-fledged healthcare provider or an AMC that also has, the academic component of that. We've been a premier Workday adaptive partner, and we're really working with them on some innovative solutions. There are a couple of questions in reference to really being able to do some predictive things in planning, and we're working alongside, Workday in reference to some of the things that they're starting to really roll out in reference to machine learning and artificial intelligence, and we're really putting the spin on this in reference to use cases for healthcare and really understanding how that can be used in healthcare. We've got a great team. Charmaine is just an example of the wonderful and just knowledgeable consultants that we have that bring both their functional and technical experience, to the table. And we've mentioned that, we've been the first really to roll out academic planning at a academic medical center for using adaptive planning. And then also right now, the project that Charmaine is leading is rolling that out at a large scale health system as part of a full-fledged Workday implementation. So we bring a lot to the table of our experience. The demo we showed you is really the work of the things that we're learning as we're building, with this technology and this tool, and have really, had the pleasure of working with it and really, having our clients really see the benefits of that. So as you're looking at where you're going, coming out of this, new normal and post-pandemic situation is, where does your organization need to be able to do some of that real-time, data understanding and decision-making and forecasting, to really do dynamic budgeting. Do you have the tools to do that? And I can tell you that, the platform that we showed today really does bring the ability and the expertise to be able to really run, a true integrated holistic process, using the tools that you need really to go forward for the next generation of planning and budgeting. We've got a few more minutes if there's any additional questions. We will be sending out the link to the recording to anyone that has registered for the webinar. So you'll be able to replay that if there's anything that you missed and you wanted to take a look at that again. If there's any questions that you guys have after you leave here and you thought about afterward, our contact information is on the screen. Please feel free to reach out. Someone just asked, do we have an NIC designated cancer center client? I have to check into that. So Core, I will definitely get back to you and let you know if any of the clients that we have are designated cancer center clients. All right. All right. Well, with that, thank you again for attending. We really look forward to working with you and having some further discussions. And hopefully this was helpful to you all to really see kind of possibilities as to where things can go and, really the tools that you can have to really help you all as you start moving forward, for the next things that you need to do. So, all right. Have a great day and thanks for attending.
Thanks, everybody.